I wanted to, I was talking with some LEMS patients recently, and we were talking about how did we arrive at March the 30th? And so I just wanted to mention that because this is so new. Um, uh, y'all obviously, I assume, have Googled enough to know that there was a Dr. Edward Lambert and a Dr. Eaton at the Mayo Clinic in Rochester, New York. And on March the 30th of 1957, um, those two doctors published a paper in JAMA, which is the Journal of American Medical Association. Um, it was an EMG study where they were differentiating between myasthenia gravis, what they were finding on EMGs, and this other uh, myasthenic disorder, which of course became LEMS. Um, and just a point of interest, Dr. Eaton is known as the father of EMG. Uh, that was his deal. And so that's why we chose March the 30th. And Rare Disease Day, someone popped up on social media about that. Rare Disease Day is in general is the last day in February. So we didn't want to be too close to that. Actually, we enjoyed being close to it, but we didn't want to compete with them. So at any rate, March the 30th, that's how we arrived at that.
So we should say Happy LEMS Day, or
Uh, Peter, I think that's up to you whether you want to say LEMS Day or not.
that's good. Yeah, that's interesting. I'm
You
glad you
know,
hit the
and
history.
that brings us, that you bring up a very good point. Um, the reason for LEMS Awareness Day is to this highlight thinking about awareness of LEMS. You
Yes.
guys were talking about it before we actually started. Uh, LEMS is ultra rare. And so we really have to work hard. It really behooves us as patients to learn about our disorder, to know about Lambert-Eaton, because we end up teaching it to people and telling
Hmm.
people about it. Because most clinicians, most doctors that we meet, they're not going to know about it. You just have to assume they don't know about LEMS because they probably don't.
That's
Uh,
right.
Now, even medical students, um, we're hearing that there are a question or two on the medical boards for LEMS, but that's pretty much the extent of it. And in many cases, they may only get one lecture on Lambert-Eaton in their medical work. So it's just something that's not on people's radar. It's a lack of knowledge that leads to not getting a diagnosis, having difficulty getting a diagnosis, or getting misdiagnosed. Sorry about that. I need to let me mute this real quickly here. Um, at any rate, so that's why and that's why we sent out these pins um, this year. They're kind of they're a tool to use uh, to give out. I mean, they're going to be a great eBay, and they're probably be worth a lot of money on eBay next year. But
I have the old version.
and that's the one we give to doctors, the one that Peter is holding. Um, and
Oh, I was going to keep it myself, but okay.
Well, you certainly can, but
Yeah, I know. I got
you take it to your doctor's office and maybe uh, or you carry it with you, and at some point maybe you meet a medical student somewhere.
got it.
So you get
Absolutely.
into a conversation, you give them a pen,
Yeah.
and that's an impression. And then every time they use the pen, it's an impression.
Yeah.
So
It's a nice pen too. Good
yeah, they
work.
are
Yeah.
nice. Um, at any rate, I think today what we'd like to do is to uh, learn what people, and we're going to do introductions here. I'll let each one of you introduce yourself, say where you're from. in just a moment. But um, and first off, before I forget it, we kind of have met our friends over in the UK. Their nonprofit over there that LEMS patients are associated with is called MyAware, myaware.org. They're in the UK. They did reach out to us. They wanted to celebrate LEMS Awareness Day, recognize LEMS Awareness Day with us. I know we've got, where was Sam? Sam's here. I wonder if we have anybody else from, so when we go around and introduce ourselves, if anybody's from the UK, we'll need to find out because I was really hoping that we would have some people show up from there. Um, at any rate, let's go ahead and do that while I'm thinking about it. I'll call your name, and if you would unmute yourself, just tell us where you're from and your name. We'll start with Tracy Sharp up in the left there.
I'm Tracy Sharp. I'm from Paris, Kentucky. And I'm going to keep mine short. That way we can get through all the people.
Yeah, and Tracy is a new board member for the LEMS Family Association. So he's just joined. He's been volunteering. He and his wife June have been going out and talking to doctors and medical students representing LEMS patients for quite some time. Okay, Richard in Canada. Come in, Richard.
I'm Richard Pollock. I'm in Ontario, Canada, not too far from Toronto.
Okay, thank you. Juliana is a founder and board member of the nonprofit. Juliana? You're muted, Julie.
Hi, everybody. I'm Juliana Kostelski, and I am a LEMS patient for 30 years. I'm in Denver, Colorado, and I love working with Tracy and Price and all of my friends with LEMS. So happy to see everybody join us today.
All right, fantastic. Kip?
I'm Kip. Is this working?
Yeah, I hear you.
Oh, okay. I'm Kip. I'm from around Dallas, Texas. I've been a LEMS patient now for about 3 years. Just really excited about getting involved in this and already making LEMS awareness everywhere I go.
All right, fantastic. Wanda?
I'm Wanda Grishkowski, and I am in Virginia, close to Charlottesville, Virginia.
Oh, okay, good. All on the East Coast.
Yes.
All right, thank you, Wanda. Lee, you want to unmute yourself and say hi? Leo, there you go.
Yeah. I'm Lee Olson. I've been a LEMS patient for 3 years and just started FIRDAPS, and I'm from Columbia, South Carolina.
Okay, thank you, Lee. Appreciate it. Hey, Deborah.
Good afternoon, everyone. I'm Deborah Carpenter. I'm in Charlotte, North Carolina. I was diagnosed in 2021.
Okay, thank you, ma'am. Hey, Alan.
Alan Stone. I'm from Miami. I was diagnosed 2016.
Okay, thank you, sir. Sam?
Hi, yeah, I'm Sam. I'm from Kidderminster in the UK, near where they make Worcestershire sauce.
All right, Sam, thank you for joining us from the UK. Appreciate it.
No, I love coming to these groups. They're so helpful.
Oh, good. Yeah, and we're going to start doing our regular monthly chit chats again in April. So we'll get the word out on that. Okay, Kristen Williams. Hey. Okay, you're muted.
Okay, there we go. Hi, everyone. I'm Kristen. I'm from New York.
Yeah, Kristen does social media for us, and she has a brand new young son. And
yes, he's almost 9 months old.
Congratulations.
Yeah.
Thank you. He might make a cameo later on. Thank you, guys.
Yeah, we'll need a cameo later. All right. Thank you, Kristen. Lori?
Hi, my name is Lori Dunham, and we live in Jacksonville, Florida. And my daughter is actually the one that has LEMS. She just turned 20 years old. I'm glad to be here.
And Grace is a fine young lady and starting college, and Lori is on the nonprofit board as well, and is the treasurer. And next is Kristen Russell.
Hi, everyone. I'm Kristen Russell. I'm from Naples, Florida. I was diagnosed about 3 years ago now.
Fantastic. And
Nice to meet you
Kristen is representing us, LEMS patients, in what is known as LUNDOC, which is the Late Onset Neuromuscular Disorder Consortium. It's a group of doctors and patient representatives. Kristen is representing Lambert-Eaton, and they are currently working on a diagnostic tool for doctors and clinicians to better diagnose LEMS. So she's working for us. Okay, Peter.
Hi, folks. I'm Pete Calori. I'm in San Diego, and next week, Tracy and I are going to be at the AAN, American Academy of Neurology, to hopefully catch a lot of neurologists knowledge about LEMS to all the neurologists accumulated in one spot. Hey, by the way, do I win a pen? Because I've had LEMS for 20, I was diagnosed in 2004. So that's 21 years. Do I get a pen for that or special award?
Well, we did ship out about 100 pens to give away.
All right. We'll guard them well.
If you don't give them all away,
We'll bring you one.
No,
you
it's
may
fine.
take one.
I'm good, guys. But yeah, we're Tracy and I, and just so people know, Price and Tracy and I have been, I guess, strategizing for getting the LEMS word out to neurologists when they're all in one place.
Yeah, and the AAN is, I think last year they said they had 14,000 doctors there.
Yep.
And it's not just doctors, but I mean, there's a
Yeah.
lot of medical students as well.
I'm
All right,
also
Peter,
finding, I just wanted to insert that I'm also finding out that from 2004, when I was first diagnosed at Dartmouth Medical Center in New Hampshire, that doctor is going to be there. So
good. Hopefully,
I was his first LEMS patient, so that's going to be kind of a neat reunion. So
yeah, that'd be
good.
fun.
Excellent.
All right, Libby, introduce yourself if you would, Libby.
Hi, everyone. My name is Libby. I am in Kansas in the US. Just recently diagnosed in the last month. They thought I had seronegative myasthenia gravis for about a year. Haven't started FIRDAPS yet, so curious to hear everyone's experience on that.
Okay, fantastic. And that'll probably come, you can come to one of our chit chats like next month. We really enjoy new patients coming to that where we can really talk to you individually in not such a large group setting, and we can spend some time with you. So
I signed up for the LEMS family newsletter. Do the monthly meetings come out via that, or is there someplace else I need to sign up?
It'll be on social media and stuff. And if you want to put your email in the chat, I'll grab it.
You got it. Thank you.
On the mailing list. All right, Mary Ann.
Hi, everyone. I'm Mary Ann, and I live in Clifton, New Jersey, and I was diagnosed in 2018.
Thank you, Mary Ann. Good to see you again.
Good to see you too.
Peyton, come in here and tell us.
Hi, I'm Peyton. I'm from Bloomington, Minnesota. If you know where the Mall of America is, that's where I am. And I was diagnosed in 2022.
Is the Mall of America pretty cool?
Yeah, it's like the closest mall to my house. So like if I go casually shopping, like that's where I'll go. A lot of people do indoor walking during the winter too, because there's
Yeah.
like 4 different levels and a lot of walking to do. Yeah.
Yeah, okay. All right. Hi, Sonia.
Hello, everybody. My name is Sonia, and I live outside of Boston in a city named Everett, and I was diagnosed with LEMS in 2021. Nice to
Thanks.
see everybody
Go
and
Red
to see
Sox.
some new faces.
Yeah, are your kids doing
Oh,
good?
Eagles.
Okay.
Sonia, I'm from Wakefield, Mass.
Oh, okay.
There. Sorry, I had to
All right.
interject.
Jenny Nelson.
Yes, hello everyone. I'm Jenny Nelson from Oregon, and I was diagnosed in December,
Oh,
maybe November of last year.
good. We're glad to have you. Thank you.
Nice to meet you all.
Good. We're glad to have you. Okay, Marguerite.
Hello, everyone. My name is Marguerite Maguire. I'm from County Fermanagh in Northern Ireland, Ireland. I was diagnosed with LEMS in November 21, but I probably would have had symptoms come back to the early 1990s with double vision. So I was put down as a complicated case because I had another autoimmune system problem, and probably just nobody listened. So nice to meet everybody.
Okay, thank you. All right, Kathy Figueroa.
Hi, Kathy Figueroa from San Jose, California. Diagnosed last week with seronegative myasthenia gravis, but the neurologist suspects LEMS as my symptoms started in my legs and arms, and I'm awaiting blood test results. And I'm thrilled to be here. Thank you.
Good. We're glad to have you. Thank you for joining us. Barbara.
Hi, I'm Barbara Sliner. I was diagnosed in June of 2020.
All right. Thank you,
And
Barbara.
I'm in Pennsylvania, right outside of Philadelphia.
All right, Philly. Thank you, Barbara. All right, Patricia.
I'm Patricia Barley. I am from Cape Coral, Florida. I was diagnosed the summer of 23. I'm going through some of my annual testing. My eye doctor is actually the one that ran all the tests that diagnosed what was going on with me. And I've had my PET scan. I've had my CT here, and I'm in the process of doing the blood work. And some of my blood work's looking strange, but I see the neurologist the end of this week, and then I'll see the eye after next. So I'm hopefully going to get some answers on what's possibly going on with. I just went to my first meeting in Miami, and I loved meeting everybody. And
good.
glad to be here in the meeting today with you, Bryce. Thank you
Okay,
for
Patricia.
inviting
Yeah,
me.
thanks a lot. Yes. Okay, and last but certainly not least is Devin. Devin.
Hi, my name is Devin, and I'm in Montana. It's currently snowing outside, so that's awesome. I was diagnosed in 2018, but I probably had LEMS since 2016.
It always snows in Montana, doesn't it?
Always.
Always.
It snowed on July 4th before.
Oh, good.
Are you serious? Really? Wow. Yeah. We forget those of us. I'm from Grand Prairie, Texas. I got Lambert-Eaton I was diagnosed in 2018. So excuse me, 2017, and so those of us down south, we don't comprehend how far north you are. I mean, you're above Colorado. Colorado to me is like way up north. All right.
Richard's in Ontario. He's further north there.
Yeah. I think, what we wanted to do today was let you speak and tell us either something that you've done that increased awareness and understanding of LEMS in your family or your medical community, or some strategy you have for spreading awareness for LEMS. I'm going to start it off. It's very brief. I have one of these pens because I got them, and I took one into I just put it in with my primary, when I went to see my primary care doctor, who is often going to maybe see a neuromuscular problem first. It's going to be the primary care doctor. So anything I can do to keep my primary care doctor aware is good. And I told her, if she had a medical student or somebody, because it's a teaching hospital where she is, if she would give that pen to them so that they, and so they would have an opportunity to, that would maybe be a reminder of LEMS, and maybe they'd look it up, maybe they would Google it. So that's one of my strategies. I used my pen to take it to my primary care doctor. If you would raise your hand, and we would like to hear what you have done or a strategy that you might have for increasing awareness of Lambert-Eaton in your family, or in your medical community. Peter, you got your hand up. Go ahead.
And I think you know this one, Price, but for everybody else, when I was first diagnosed, I was the very first that they had seen in Dartmouth-Hitchcock, which is a major medical school in the Northeast, Dartmouth University, Dartmouth-Hitchcock Medical Center. And part of what I've done over the 5 years that followed that, while I was still living in the Northeast, is I went to the Gastro Disease Grand Rounds, they're called, where all the medical students assemble, and you describe your symptoms, and they basically analyze it. I say, as a layman, they guess. That, in those 2 sessions, I would say the awareness of LEMS leaped. Because none of them had heard of it. They were all Googling and trying to figure it all out. But what they learned was that the symptoms, which clearly indicated I had either MS or poisoned fish or whatever else they were thinking that I was originally diagnosed with, all of a sudden started realizing, oh, there's something else to look at. Those were 2 events of grand rounds that I attended there. And that was in, as I say, I was diagnosed in 2004. So that has developed from that. The other part I noticed is in listening to the introductions, a lot of folks have been diagnosed within the last just several years. So whatever you're doing, Price, in awareness is working. The doctors are catching it. A lot more diagnoses in the last several years. And then the final thing I'll point out is that Price and Tracy invited me to be part of this awareness extravaganza in San Diego with all the neurologists in one place at one time. So hopefully that'll take a real bite out of the lack of awareness amongst those neurologists and anybody associated with the neurologists. So it isn't the doctors, it's all of the other support people too that are going to be there too. So, okay. So what you're doing is working. And I see, I'm counting, what do you have, 20 people on this call also? So that's, you're creating some momentum in awareness, it's working. So
all right.
That's it.
Peter, thank you very much. And we'll look forward to hearing from you and Tracy, maybe at our April call. our chit chat and find out how that went out there in San Diego. So, all right, who else has something they'd like to share? I've got Kip. Okay, I see Kip. Go ahead.
All right, I got the video to work this time. But so what I'm doing is, because I was so misdiagnosed throughout the beginning, and also my dad had a rare paraneoplasm syndrome. He had limbic encephalitis with small cell lung cancer, and so when I started going through this, nobody really knew what it was. And once they did the positive VGCC test, everywhere I go, as far as the doctors, I educate them before they do anything to me. You know, I have Lambert-Eaton, do you know what it is? And start explaining to them, because I don't know about y'all, but my body does some pretty weird things. I mean, my legs jump, my arms jump. I have pseudobulbar effect with it. And so, in fact, they originally, after the stroke, diagnosed me with bulbar ALS. And so I have some weird things. So anytime I go into a doctor, I automatically tell them, I have Lambert-Eaton. Do you know what it is? This is what my body does. This is the symptoms. You know, and it's really a good education for them, you know, because most of them have not heard of it. And the ones that have, if they've seen any patients, they've only seen one or two. And
Yeah,
so
that is a great
yeah, go ahead.
strategy, and that's one that I do try to do as well, because we do see a lot of different doctors. I see
Yes.
my eye doctor. I do the same thing. He knows about Lambert. He's actually very curious about it. I just
Yes.
met a new diabetes clinician this past week, and I had to make sure I mentioned to her, I have Lambert-Eaton myasthenic syndrome. Do you know about that? And
And excuse me, Chris, but everywhere, like I said, my body does such weird things. If I sit too long and I get up, my body, you know, has spasticity, rigidity, starts jumping. So literally everywhere I go, if I go to a restaurant, I explain to the waiters and everybody, look, I have a rare neuromuscular disease. It's called Lambert-Eaton, and describe to everybody. So that's another good way, you know, if your symptoms are presenting um, a lot. And also just one more thing on my personal side with my friends and family. I chose to use my social media, and so about every couple of weeks I make a couple of videos and share my story, and let all my Facebook friends and family watch as I go through this, the different diagnoses. Um, Today I put it's LEMS Awareness, to have all my friends, you know, put that on there. So that's some of the things I do. I get on social media and share my story.
so you use social media to spread the word. I think that's fantastic.
Yes.
All right, thank
So
you. Let's just take a moment here because Kristen's got her young. Bring that little boy up where we can see him, Kristen. I see you've got. I've forgotten his name. What's his name?
His name is Nolan,
Nolan, of course. Oh my goodness.
and he just maybe fell asleep.
Oh my.
what a cutie.
He's a,
Thank you, guys. Thank you.
he's a
It's
darling.
Mother's Day in the UK, so happy Mother's Day.
Yeah.
Thank you.
Oh yeah.
Give
Okay.
him a big hug for me.
All right. Who else has got a? That was some really good stuff from Kip there.
Is my
Who else?
picture still up? How do I take it off? It
You
won't come
can
off.
just there's a video. You can touch on the video, and it will switch
If-
off your picture.
If I
All
could,
right.
just quick.
Jen, go ahead.
Yes, so I have to be leaving pretty soon to head to church, but I wanted to just say that it's fairly new for me, this diagnosis, and I'm learning a lot. Family's learning a lot, and I really chimed in just with an openness to hearing what you all are doing so that I can learn, you know, what's working and getting the word out about LEMS. And also, I love hearing about all of these gatherings and meetings, and I would love to know when anything's going on. And I've put my email in the chat.
Okay. All right. Thank you very much. Appreciate that.
You.
All right. Well, we're glad to have you. And if you need to leave, just you can leave at any time. And we're glad that you were here.
Okay, I'm probably going to keep myself muted so I can travel with and listen as I go.
All
Thank
right.
you.
That sounds good. Okay. Thank you. All right. Somebody else chime up. What have you done? Any thoughts on something that you could do to increase awareness in your family or with your doctors? I got Lee. Was that Lee? Did you raise your hand?
Yes,
Go ahead, Lee.
yes. My wife reminded me that I said, I don't think I have anything. And she said, yes, you do. And I have a new neurologist about 2 years ago, and he only had one confirmed LEMS patient and one probable LEMS patient. And he started testing all his patients for LEMS, and now he has 10.
Wow.
He has 10 LEMS patients.
I thought it was 6.
And
Your
so,
wife is smiling in the background, by the way.
yeah,
I think it was 6.
she's a typical wife. You know, if I say 10, she says 6. So,
Oh, it's great. Yeah.
but the point is if you can get your doctor to test more,
Yeah.
he'll find more, because that's
You
how I
got-
was found.
Thank you. Thank you, Mrs. Olson.
I guess, they become more familiar. They know what to look for. They know what to associate with.
Yeah.
And that leads to a better diagnosis, an earlier diagnosis. So those of us who were misdiagnosed or not diagnosed, I think it really makes you more of
Yeah.
an advocate,
Yes.
because it took me 8 years. I was in the hospital for 6 days with a crisis, and I never got a diagnosis.
No.
It took me 8 years. So I think it's very unfortunate when that happens, and I'm certainly not the only one. Okay, Deborah, you're raising your hand. Go ahead.
Thanks, Bryce. Things I do with any new physician, and since I've moved, I have a lot of new physicians. I take a fact sheet, and you can get those on NIH. You can get them on NORD. So I take like a fact sheet, and then there's a litany of drugs that are counterindicated, and I take those with me to every physician so they can put them in my system. So those are the things that I do every time. In terms of my family, I've encouraged them to look at different newsletters and the Nord site just so they can understand.
That's a great idea. And
Good idea. Yeah.
especially things like carrying a list of contraindicated meds. Like if you're going in with an infection, there are some antibiotics that are not recommended. So
Also the the anesthesia drugs. That's what I was asking.
Yeah.
And I had one physician's assistant who prescribed muscle relaxants, and I mean it's like absolutely contraindicated, and so a lot of unknowns out there.
Yeah, and they don't know any better. It may be a drug that they commonly give for that.
Could I ask Deborah a question about, because I have looked for a list or some sort of a red flag list of drugs you cannot take with FIRDAPSE.
Well,
Or you shouldn't take with LEMS. We didn't get the list.
There's a couple things. There's a flyer that is really aimed at myasthenia gravis.
Yeah.
So I use that as a proxy. And then I had a periodontist who got an article, a peer-reviewed article from, I think it was Lancet. And so I take that for just, all kind of myasthenia syndrome issues. And then there's a couple other articles that I've cobbled together. So it's not like clear, but it's instructive, and it can be overwhelming. There's so many, but those are the three things I take.
I think since you've mentioned it, it's Juliana, I'll ask you, but I'm gonna on our nonprofit website, we have a resource page. There are a couple of downloadable PDFs. One of them is symptoms and symptom overlaps, and the other one is the physiology of what's going on with Lambert-Eaton. I
Yep.
think we need to find a good vetted list of contraindicated medications and put that up there for people to be able to download as well. And so we'll do that. That's going to be on my to-do list. And Juliana, do you have that list on your Facebook group page?
Not anymore. And that's one of the things that I had on there with my old account that got hacked. So it's not on there
Okay.
anymore.
Okay.
So we need to really, yeah, we definitely need to work on that and get that for everybody.
Okay, great. Let's see. Am I looking at everybody?
Hey,
I wanted
Bryce,
to let you know,
Richard's had his hand up for a while.
Who has?
I
Richard,
just posted
Okay.
the URL
Yeah, I
for
see Richard, Mary Ann, Sam, and Devin. So let's go. I'm going to go left to right here. Richard, go ahead.
Yeah, I've registered with a organization called the Neuromuscular Disease Network for Canada, and they have training modules for patients and researchers who want to be involved in what they call patient-involved research, patient-oriented research. What they mean by that is where the patient is more than just a subject. They're involved in developing the research question, co-designing the actual research methods, and making recommendations on how to share the research results. Now, we are talking about like drug trials, the sort of type of research that's done in universities or government agencies. So I did the training modules, and I'm trying to at least organize with, I guess, a cluster of other myasthenic syndrome patients and there are different myasthenic syndromes besides LEMS, to, make some noise.
Okay, good.
So we've also registered with Muscular Dystrophy of Canada, which is really the agency that has the money, and
Yeah.
researchers are getting paid from, and hopefully that will amount to something, but nothing as yet.
And
But
you
it
know,
sounds like the
we do a
doctors
lot.
there are communicating. So
We do a lot of this without any payoff. There's not any immediate payoff. Sometimes there is. You're talking with somebody and you're enlightening them right there. But sometimes it's just kind of a conversation you have, and then you hope it pays off down the line somewhere. Okay,
Yeah.
Richard, thank you. Mary Ann, you're next.
What I do is I bring with me, I actually made copies. This was in our welcome packet. I don't know if anybody has this. And it explains about Lambert-Eaton to the doctors, and it tells them about what they should look for. So I find this very helpful, and I make copies of it and I bring it. I brought it to all the doctors, but I also always bring it with me to every visit. So the information is always available. In addition, I also bring all of the cautionary drugs. I have a list of those that I printed out, and I have that with me at all times. And I bring it to the visits and we talk about it. I also owe every visit that I go to, I always bring my medical, surgical history and the medication I'm currently on. So we can review that. One thing I also found that because the FIRDAPT is coming from a Novo pharmacy, I don't know if anyone goes to a local pharmacy for any other medication they may be on. So the local pharmacy doesn't know that you're on FIRDAPT. So it's important to share that information with your local pharmacy, because a drug might be ordered for you that's contraindicated with FIRDAPT. So it's important that the local pharmacy also know about what you're doing. So those are some of the things I do. And as I said, I bring my packet with me at every visit, even though I've shared it with them. but I also have it with me at all visits: dentist, eye doctor, rheumatologist,
Hey,
endocrinologist.
Marianne,
Yes,
could you hold up please hold up that blue brochure? What is that? I've never seen
this
it.
was in my welcome packet when I started on FERDAPS. Did
Okay.
anybody?
Is that the cover?
This is
Hey,
the cover.
where did you get it?
I
Tell
got
me.
it from my pal when I first started on FERDAPS in
Yeah,
Oh,
when,
cool. All
when
right.
you start on FERDAPS, Catalyst gives you a lot of materials. And Catalyst also
Yeah.
used to give a small pocket card that
Yes,
you could
Yep.
fill out with your name, and it had just kind of a bullet point
yes.
uh, information about Lambert-Eaton that you
Yeah.
could just have in your pocket. And yeah, Marianne, go
Yeah,
ahead.
I do have that in my wallet too, and it's a help because if you are
Yeah.
in an emergency room or a setting that you need to
Yeah.
communicate that information,
Good.
emergency center.
I'm going to
that
ask for
in
you a
my wallet.
copy of it. Thank you. Thank you.
Yeah,
That's good.
so yeah, I would
Yeah.
reiterate what you're saying there, Peter, which is
Yeah.
if you have a PAL,
Yeah.
you have apps,
Yeah.
you
I
can
didn't know it came from.
always speak out to your PAL and ask them,
Yeah.
hey, I need this. That's
Yep.
their job, is to get you
Absolutely.
what
Yeah.
you
I
need.
didn't realize that came from Catalyst. I hadn't seen that before.
Yeah.
That's good.
All right,
I want to
Marianne.
interject something else because I've got another condition. I have a medical alert bracelet. And part of the effect of LEMS has been weakness in the heart muscle, one of the muscles. So I have this, wearing this. On the back, it says Lambert-Eaton. When you call that number in, they actually have the database for LEMS at the medical alert call-in numbers when an EMT or anybody in an emergency room or a doctor calls it, and they say, they give the serial number on the bracelet, they've got it.
Where did you get
So,
that? Where did you get that, Peter?
it's a medical alert. Medical alert. It's the same thing like if you have a heart condition or you see these medical alert bracelets. People have them on
Yeah.
necklaces.
Right.
And it looks like, if I can get it to the camera, I'm going the wrong way. There it is, right there. See it?
Okay. Got it.
All right. And on the back, it tells you what the condition is, and the EMTs wouldn't necessarily know. Whoa, what the hell is that? They'll phone it in. They enter the number into their unit, either tell the number or whatever. But I tested this one time on an invitation. They said, please call and check it. And they pulled up the number and my background, and they had LEMS, and they had the whole description of it, and they knew what drugs I was taking. Everything was in it.
Great.
Yeah, it's that's the medical alert system, which is a great system. I think it costs about $20 a year or something to have the bracelet and be in the database.
All right, Peter, thank you. Sam, go ahead. You got your hand raised.
Thank you. First of all, I just want to say hi, Marguerite, because Marguerite comes to the UK LEMS, so it's really nice to see her. Equally, I'm very disappointed that not more people have come from the UK. I think this is something I'm going to have to take up with my aware, because we really do need to make LEMS more aware, have more awareness about LEMS. I want to say thanks to everybody because you've got so many great ideas. You know, I love Kip's idea about the social media. I love Deborah's idea about the fact sheets and the medical bracelets. They're brilliant and things I'll take on board and go to my aware about. Personally, I've tried to increase the awareness of them. So, like, I've been going down to see student physiotherapists, or is it physical workers you call them in America? I'm not sure. And teaching the students there about LEMS and the physios and getting them to give me exercises to try and improve my muscle strength. Last year I went to the My Aware meeting and talked about my experiences in LEMS, which was actually quite successful. And the local soccer team that I go to, they've really been supportive and taken on board about LEMS, what LEMS is. So they've been really, really, really good. I don't know what else to do. I mean, I feel quite frustrated. Frustrated is not the right word. Limited in what I can do in raising awareness. I'd like to do more, but I'm not sure how I'm going to go about it in the UK because I need my aware to support me. And I think me and Tracy have been onto the UK LEMS group so many times about the importance of joined up thinking and getting together, but nothing ever seems to happen. Would you agree with that, Tracy?
Tracy,
Yes, yeah. I had to get me on mute. Yeah, I did a drop-in meeting last week and tried to get some more to come to the meeting. And I think there's another meeting next week on Friday.
Yeah, it's Friday. I think me and Marguerite will be there. Will you be there as well? Because I know it'll be very early in the morning.
I'll probably be on it early. I got it, it's going to be a 6 o'clock meeting for me. At 8.
Can I ask a question? Why, Sam, do you think it's more difficult in the UK?
I'm not just. It's I could put with my senior awareness group that they do like a my senior week, so they put everything under one umbrella. So it's like MG and LEMS and what's the other ones? Congenital, isn't it? So I feel that this is general sort of awareness about myasthenia, but nothing specific about LEMS. And that's what I feel we really need to focus on at times, because the numbers are growing. They will grow when we get better diagnosis, and people need to be more aware of it, and especially GPs, because although I was very fortunate that I got diagnosed very quickly, there was a lot of signs and symptoms, and there was no joined up thinking, which actually delayed my diagnosis and delayed me getting onto the right medication. So I just wish I could do something more in the UK. I don't know how you feel, Margaret.
Almost done with this.
Yeah.
Wait.
I'm trying to help as much as I can.
I can't hear.
Thank you. But I will keep doing my little bit. I'll keep plugging away at the doctors, and I'll keep plugging away at the dentists and all the medical staff.
You just seize an opportunity every time you see it. You recognize an opportunity.
Yeah. My daughter, well, my wife and daughter are both very extremely supportive, but my daughter is doing a sky jump in June for the My Aware, but on her link, she's talking about LEMS to try and raise awareness about LEMS, which I think is, bless her. I wouldn't jump out of an airplane.
Hey, Sam, I have a question. Do you have access to FIRDAPS in the UK? What medication do you have?
We don't have FIRDAPS. We have. Excuse me, because I get mixed up with the branding, so it might be the same. But we have. I'm on DAP 3.4.
Yeah,
3.4 DAP.
Yeah, okay, that's what I had. I used that for almost 20 years. Yeah.
Yeah, so I'm on DAP.
It's good.
Peristigmine, immune suppressants, steroids, you name it, I'm on it.
Okay. And when your daughter is ready to jump out of the airplane, ask her not to call me.
Well, I've been told I'm the one that's got to stand on the ground and catch her.
There you go.
All right. Hey, Devin, you've got your hand up. Come on in here.
So one thought I had, would we ever want to like produce videos or something like that we could potentially post to our Facebook page, or start like a YouTube channel or TikTok or whatever?
That's an interesting idea. Hadn't thought of that.
I don't know if you've ever seen, I share on my Facebook every once in a while some science videos that we make for my work, and I film all those and I edit those myself. So if we ever wanted to do something like that, I'd be happy to edit it, put it together.
How could we see that so we see what you're doing?
Like some of the videos that I've made in the past this is unrelated to LEMS. It's just videos I made for my work.
I see.
Yeah.
Not LEMS related, just
a great idea.
I've watched a couple of these videos. They're pretty good.
And not everybody has video skills, but if you do, most people's phones have a camera, have a video camera. There's nothing. That's a good idea for any of us who can do things like that, to utilize that. I've taken videos and recorded my audio as well, and shown it to my doctors, because they don't always see our problems. You go into a medical appointment you look great, but hey, you didn't see how crappy I was walking when I was having a big problem. So there is a good use for that, Devin. I agree.
I think it's
Yeah,
a great idea.
It's a good
can I
idea.
interject here?
Who was that?
It's Kip.
Yeah, Kip, go ahead.
So talking about the videos and stuff, like when I do mine on social media, um, there's a pretty good following. So I think that's an awesome idea. I'd like to link up with him and see how we might be able to do some of that, because usually, like just on my Facebook, there's usually at the end of them, you know, I do usually 2 4-minute videos every few weeks, and there's usually at least 4, 5, 600 people following it every time. So I think that would be an excellent idea.
Maybe we need a YouTube channel. Maybe we,
I,
I don't know how to do that, but maybe
I
we,
don't either, but people, the people on my social media, they've been wanting me to do something like that. I just don't know the platform or how to do it. So maybe we can brainstorm and do something like that.
all right, that's a good idea.
As a newly diagnosed person, I appreciate videos and people who are willing to put themselves out there and make them, because it was something that I was looking for to figure out what other people with LEMS moved like, even.
Right.
Does it match what I move like, etc.
I have seen
Right.
some videos, and I've actually taken a video of LEMS patients walking, including myself, when we don't look right when we're walking, and
Yeah.
that's all really. It's very. It can be reinforcing to you, but it can also be reinforcing to someone else who maybe doesn't get it. It kind of
Right.
helps people get it.
Price, can I insert real quick too?
Yes.
Because Libby, when my daughter got sick, of course, we don't know anyone with LEMS. And that was like the biggest thing I wanted was to know, what is this going to look like in her life? What does she walk the same way everybody else walks? Is she worse than other people? You know, I had no idea what it was going to look like for her. So I think that would be a great resource for us to have. Yeah, and I know Price was the first one we met that, well, maybe Tracy. But anyway, until then, I had never seen what LEMS looked like in someone else.
Yeah.
So I think it's a great idea.
Very good point. Kathy, you've got your hand raised.
Yeah, a couple of things in the chat. I put a URL for the MG contraindicated medications. I don't know that it's the same for LEMS, but at least it's a pretty full list. One of the other things that MG has is a thing called a heat kit, and it's for the emergency, and it's 17 cards. I don't know if you can see the table of contents on it or not, but it covers everything that you need to take with you to the ER if you are having a crisis. And then the other thing I wanted to share is my medical ID. This is my medical ID. It's a QR code. It can be scanned immediately by anybody.
Sorry, I'm not seeing that.
What is it, Kathy?
It's a QR code. It's an ID that a medical ID.
Oh, it's on your watch. Pull it
On
back. It's
my
on your watch band. I got
I
it.
got this from Amazon.
Okay.
It's an app. You inload all your information, anything, your doctors, your conditions, your prescriptions. It can be accessed by anybody. You get a notification if it is accessed, and it's immediate access to any information. So if the EMTs come, they can see everything that's going on with you right away.
Yeah.
So I did Medical Alert. I think it cost me, I forgot what it cost, like $10. It's a one-time thing. Pardon?
No, go ahead.
Oh, I was going to say, I think it might be more useful than them having to call. For me, it's more useful for them to be able to access the information immediately rather than needing to call into Medical Alert.
Right.
And I was on Medical Alert for years just for some other stuff. And if you're not comfortable with the information being able to be scanned, I can completely understand it. But my husband's tried it, I've tried it, and it's really nice to have everything. I've had all my doctors, all my meds, all my conditions on there, all my.
Kathy, could you put it up on the screen, but not so close to the screen this time?
Sure.
Back up. okay, it's a regular, like a Apple Watch.
Yeah,
All
just
you
It's
put
not,
it
it's
on the
a,
watch.
it's
clips
something you
to
put
your.
on the band. You put it on the watch band.
Right, you put it, oh, it's not the watch, it's the
It's not
band.
the watch. You put it on,
Okay.
oh, hang on
And
just
where
a
did you get it? I'm so
What's
sorry.
it called?
It's called My ID. You get it on Amazon.
Thank you.
And I think it's like, if I don't remember, it seems to me it was less than $20.
Can I interject? You can get it from Catalyst Pathways. They provide keychains, wristbands, all the same thing, My ID.
Yeah.
Yeah,
Is
yeah,
that
Barbara.
is that a QR code too on the stuff that you
Yes,
just
it's on the back side of the.
Awesome. That's awesome. I just figure this is what works for me. And of course, you always have to do whatever works for you, what you're comfortable
Yeah.
with, if you're comfortable with people.
And
But
that's,
you can choose what information they see and don't see when they scan the QR code.
well, yeah, and the reason and I like that. I'm gonna take a look at it. The medical alert, because I have a pacemaker, because of the effect of LEMS,
Mhm.
they can't. They need to know that before they even make the call, so that there's
Yeah.
no shocking.
Yeah.
Explode the pacemaker. So yeah,
I
and
have some
I'm gonna get one of those
similar.
tags too.
I'll put a URL in the chat from Amazon so you can access it directly. I have the same thing. I have some conditions where I want them to know right away what's going on with me. So I'll
I
go.
just started going on Amazon to look for it. Thank you.
Did you? Okay. I'll be glad to put a URL up too. Okay.
I'm in my phone on Amazon right now. Thanks.
Kathy.
Barbara,
Kathy.
Barbara, I saw you holding that up. Was that what? Why don't you go through that again?
I got this from Catalyst in the welcome packet. You can either get a keychain, you can get a wristwatch. I have the wristwatch. I carry it on my walker all the time. This I'm going to put with my keys for when I go out of the apartment because I don't always take the walker. Sometimes if I'm feeling well, I can just use a cane to go out. So yeah, I got it through my pal.
All right. And I have used Ride ID before. That's a real common one. Cyclists use that. Athletes use that. It's called Ride ID. And they
Ride
have,
like ride bike?
Right.
RIDE?
yeah,
Okay.
RIDE, Ride ID.
ID. Okay, good.
That's another company that does really good wristbands.
Yeah.
Just different styles. It's all the same objective. This has been a fantastic meeting. I think we shared a lot of good information, and that was the point. That's the whole point of LEMS Awareness Day, is increasing awareness in our medical community, in our family, so that our family understands better what we're going through and can, some of our family is caregivers. So it's good for them to understand why we need their help. And so with that, I think we'll go ahead and wrap it up. And I really appreciate it. Everybody have a great rest of your weekend.
Thank you.
And we'll have a meeting in April, a chit chat. And so we'll get the word out on that. Just watch us on on Julie's Facebook page, on our Facebook page, on our lemsfamily.org website page. That information will always be there. So, and Kristen gets it out on social media. So the word will be out. So thank you all very, very much.
Thank you.
Thank you for doing this.
Thank you.
Thank you.
Appreciate it.
I'd say Happy Awareness Day, but let's all be LEMS aware.
Happy LEMS Day.
Happy LEMS Day. Bye, everybody.
Everybody, thank you. Bye.
Thank you.